Good afternoon, ladies and gentlemen. I have the pleasure to welcoming you at our dissemination event. And the objective of our meeting today is to present findings of the health chapter and to launch interactive dashboard with the related data. Health is already the eighth policy area covered by our benchmarking study 2022-2025. We are doing 4 and also in very close cooperation with the Ministry of Interior of Kingdom Relation of the Netherlands. But before I present our study objective, research areas, time frame, and our team, I wanted to thank you for finding the time to be with us today. What actually our agenda of our meeting today looks like. So we will start with a short introduction to the benchmarking study objective, areas, countries covered, also what we are doing now, what will happen in the future, what happened in the past. Secondly, we will present the research results of the health chapter, and then we will continue with the presentation of our dashboard. And our APA team will show you how our interactive tool works, where to find it, what kind of data we can find there, and how to use it effectively. And at the end of our event today, I will present what's happening in 2025 and what's planned in 2026. And as I already mentioned before, we can realize our benchmarking study 2022-25 thanks to the grant of the Ministry of Interior and Kingdom's Relation of the Netherlands. And we are also implemented this project in a very close cooperation with the ministry. And I have the pleasure to present project leader from the ministry side, Mr. Frans van Dongen. Thank you very much, Frans, to be with us today, and I would like to give you the floor.
Thank you very much, Ivona. It's great to work with you and the whole APA team on this international benchmark program on public performance. And I warmly welcome you all at this APA webinar for the study results regarding the public domain, health, and the launch of the data dashboard for this domain. My name is Frans van Dongen, as Ivona explained already, and I'm a program manager on public performance at the Ministry of the Interior and Kingdom Relations in the Netherlands. The Dutch Ministry of the Interior has already a long tradition in international benchmarking of public performance, going back to the 90s in the last century. We are very happy that we could establish a fruitful relationship with APA a couple of years ago, to deepen this tradition with an extensive 4 years benchmark program for 35 countries. We strongly believe that policymakers can learn a lot from international comparisons of public performance in different kind of functional policy domains. And this is not about winners and score lists. It is about identifying mechanisms, policy systems, and interventions in contexts that are relevant to become more successful, get better public value, better outcomes, more efficiency, and more satisfied citizens and entrepreneurs. And a part of international learning from best practices, it is also valuable to learn from examples of underperformance or failures. It is helpful to learn why specific mechanisms or interventions don't work in specific contexts, and to prevent that these failures will be repeated. Systematically learning from failures is of great value. Further, it is of the greatest importance to bring these kind of study results to the attention of policymakers and stimulate them to use them for the purpose of policy designs. And therefore, we welcome very much the initiative of APA to organize webinars like this one and to disseminate the study results. We also welcome the initiative of APA to give full, flexible, and user-friendly online access to the data of the study results. I'm happy that we will get a demonstration of the online dashboard for the health sector data. And lastly, I would like to thank our health sector research partners, Enrique Bernal Delgado, Esther Angulo Puello, and Santiago Arroyo Sierra for their outstanding achievements with this international benchmark study on health, and Esther especially for her willingness to present the results here. I hope you all will have an inspiring webinar and give the floor back to Ivona Karwat. Thank you very much for your attention.
Thank you very much, Franz, for your very kind words. And I would like to propose that we continue with the presentation of the APA team. Let's hope it works. Perfect. And I propose that we start with Miranda, then we will continue with Paolo Ibiorn. So please, this floor is yours.
Thank you, Ivona. So I'm Miranda. I work at APA as a senior research officer, mainly in the area of better regulation. But today I'm here because I work with the team on the benchmarking study, mainly with the data related aspects, but also for these dashboards. Yes.
Yes. My name is Paolo Giovannetti. I'm a research officer here at APA, and I worked on the benchmarking study since the beginning of my time here, especially for what concerns all aspects related to the publication of the different chapters, as well as the aspects related to the data analysis and data visualization, of which the dashboards are a very important component. Thanks.
Hello, my name is Björn Höbling. I'm a research and digitalization officer here at APA. I naturally work already in the field of effective governance, so it was a no-brainer to join that project. I was really glad that for the dashboards themselves, in regard to data visualization, I joined the team and I found it a very rewarding experience. So thank you.
Thank you very much. I think right now it's my turn to present myself. My name is Ivona Karwat, and I'm a senior expert in APA and also project leader for this benchmarking study. And thanks to that, I have the pleasure to work with Franz, our APA team, and with best experts from some very prestigious universities and institutes. And I would like to propose that we continue with our presentation. So I will, as mentioned in the beginning with the introduction, present you exactly the objective of our study, countries covered, policy areas covered, and everything what is related to the benchmarking study. The main objective of our benchmarking study is to analyze the performance of public administration in 10 different policy areas and in 35 different countries you can see on the slide. So apart from 27 EU member states, we also analyze UK, Norway, Switzerland, and Iceland. Apart from European countries, the study also covers Canada, United States, Australia, and New Zealand. And we analyze the performance of public administration in 10 different policy areas. I will also present a bit more in details in a second. But actually, what our benchmarking study is and what is the main objective. So our benchmarking study is already the 4th edition of the report, and the previous ones were published in 2004, 2012, and the 3rd report prepared by the Dutch Research Institute, SCP, was published in 2015. And when we were preparing for the entire benchmarking study during different meetings with the ministry and with Franz especially, we agreed that our, let's say, analysis would be a bit different and would consist on, from one side, the update of the SCP report from 2015, but also it will be to broaden its perspective. So apart from the same type of indicators, quite similar policy areas, we evaluate also effectiveness, efficiency, cost effectiveness of all policy areas, as well as satisfaction and trust of citizens in their administration, which was the new element. As we can see here, we use the, I would say, traditional conceptual framework, however, quite adapted to the needs of our benchmarking study. And also in 2021, during the preparation process of the entire benchmarking study 2022-2025, we agreed with the ministry that we will divide the study and the analysis into sub-studies. So we agreed that the sub-study 2022 will cover 4 policy areas: public administration, education, housing, and social safety. And 2023 and 2024, 3 policy areas. So in 2023, we analyzed the performance of public administration in economy, infrastructure, and science, technology, and innovation, social security, employment, income, and wealth, and also environmental protection and climate change. In 2024, we analyzed health, and we will present the study results today. That's why we are all here. Sports and social security systems. We also agreed that in current 2025, we will do the update of the entire study and present the final report in February 2026 at the occasion of our final conference. We also agreed, however, last year that we will divide agreed chapter, let's say, sports, culture, and participation in 2 separate chapters. So in 2024, we did the analysis of sports, and the culture and participation will be presented as a separate chapter in our current research 2025. And also social security system. Actually, at the end of the negotiation, we agreed that the exact title will be International Best Practices in Social Security Systems. And during the preparation process of our benchmarking study, a part of kickoff meeting in the beginning of each year, we also were organizing 3 different types of meetings. Coordination meetings between all partners, ministry, and the APA team in order to agree the content, indicators, visualization, etc. We also had and have coordination meetings for each policy area and internal working meetings between partners and the APA team. And we are doing the quantitative and qualitative analysis using already existing data starting from 2007 until today, whenever it is, of course, available. So everything depends, and it's quite different in each chapter, and already existing sources of secondary research. And one of the most important elements of our study as well is dashboard, and we are launching today the dashboard for the health chapter. And our dashboard, as we can see here, is an interactive dynamic data navigation tool, and it's providing insights of the most important data at the glance. It's publicly available at our website under the benchmarking study, and I will show you just in a second where exactly we can find all the information. This dashboard is, I would say, updating during the duration of the entire study. So here it's when you enter the APA website, we can see where the flash is public sector benchmarking. And there we can find already published sub-studies 2022, 23, and 4. And all information about dissemination activities and our dashboard for each policy areas. And as you could see, our dissemination activities are recorded. So also when you are entering there, you can find all videos from the previous events. And I propose, as our time is quite limited, that we go into next, I would say, point of our presentation of our meeting today, and presentation of the study results. And I have the pleasure to present our next speaker, and one of the 3 authors Franz already mentioned during his presentation of the health chapter, Dr. Esther Angulo Puello. And Esther works as well as Enrique and Santiago as a researcher in the Data Science for Health Services and Policy Research Group at the Institute for Health Science in Aragon in Spain. And her main area of research is the analysis of health system performance and R1 rate variation in medical practice, as well as health policy analysis. And it was a real pleasure to work with you, Esther, as well as with Enrique and Santiago. And I would like to express my gratitude for you and for entire team to work with us, for great job, and for you especially to be with us today. Thank you very much, and I would like to give you the floor, and I would stop to share my screen.
Thank you very much, Ivona, for your nice introduction. It was also a pleasure for us to work with you in this project. So I will now to share my screen. So let's see. Okay, are you seeing the screen? Okay, so as Ivona said, I'm going to present a brief summary of the results that we have found in the health chapter. And also, I want to acknowledge my colleagues, Enrique Bernal Delgado and Santiago Rollo Sierra, that are also co-authors of this chapter. Okay, so this is the general index of the chapter, and we have followed the framework of the benchmarking studies that are based in the input-output outcome model. And so, as the other studies, we have made a descriptive analysis where we have compared 41 indicators in 34 countries. Those indicators are, most of them have been used previously by the OCDE or Eurostat in previous analysis, in previous studies of international comparisons. But also, we have made a performance profiling analysis. In this analysis, we have compared the health system in the Netherlands only with those countries that have a similar performance than the Netherlands in order to increase the validity of the analysis. So in this case, we have compared 17 indicators in 22 countries. So let's begin with the key findings. So here we have the inputs. The inputs are defined in the healthcare context as the financial, human, and structural resources. So here we have the health expenditure in all the countries analyzed. So we can see that in the Netherlands there is a high level of health expenditure, that in 2022 it accounted for 10% of the GDP, meaning that around 4,530 euros per capita. So this is really a high number, and it's only surpassed by Switzerland, Norway, Germany, and Austria. So when now here we have the health expenditure by financing scheme in 2022, and here we are comparing the Netherlands with the countries that have a similar performance. So we see the median of all these countries in gray and the results of the Netherlands in orange. So we can see that, that the government compulsory schemes accounted for 84% of the total expenditure in the Netherlands, and this is a high percentage that is above the median. Something similar occurs with voluntary healthcare payments that accounted for 5.7% of the total expenditure, and it's above also the median, but very close to it. On the contrary, we have household out-of-pocket payments that only accounted by a 10%. And this is really a very low percentage, and is similar to other countries that share this low percentage. So, well, when we analyze the health expenditure by function, we found that curative expenditure is really low in the Netherlands. So above all, that related to inpatient care. So we have here that in the Netherlands, that kind of expenditure only accounted for 70%, whereas the median of the countries was around 24%. On the contrary, long-term care expenditure is one of the highest in the sample. It accounted for more than 28%, and the majority of this expenditure is caused by inpatient long-term expenditure, that is nursing homes. Preventive care expenditure is also above the median, and it has to be noted that this expenditure has increased a lot during the pandemic. So when we talk about human resources, we see that practicing physicians, the ratio is below the median, while the number of practicing nurses is above the median. In both cases, the number has increased in recent years. So the next section would be the outputs, and in this case, the outputs is the activity generated by the healthcare system. For example, here we have the vaccination coverage. These are the results in 2022 also, and we can see that the influenza vaccination rate is above the median, but on the contrary, children vaccination is below the median in both cases, in measles vaccination and diphtheria, tetanus pertussis vaccination. It has to be noted that the ratio of measles vaccination is the lowest of the country sample, only reaching 89% of the sample. And in both cases, in measles vaccination and DTP vaccination, there has been a decrease in recent years. We also have seen a decline in cancer screening programs. Here we have two examples, breast cancer screening and cervical cancer screening, and in both cases we have a decline since 2010. In the first case, a 14 decline, and in cervical cancer screening, a 13 decline. This decrease was exacerbating during the pandemic. Okay, and as outcomes, we have to say that outcomes we understand as outcomes in the healthcare context are the consequence of the healthcare activity on the population in terms of health, but also in terms of well-being. So here we have life expectancy. So we can see that in the Netherlands, there has been a steady increase over the years, and the numbers in the Netherlands are above the average of the analyzed countries. On the contrary, when we see healthy life years at birth, we see that the numbers in Netherlands are below the average, and there has been a decline of 3 years since 2011. We can imagine that at least 2 shocks can have affected these healthy life years. Maybe the economic crisis in 2012 and also the COVID pandemic in 2020. So these shocks may, at some extent, partly explain that this decrease in the Netherlands. It has to be said also that life expectancy is not only related to the health system. So there are other factors that affect this kind of indicators. For example, lifestyle or socioeconomic status or environmental factors. So these numbers are not only the consequence of the activity of the health system. We have to keep in mind that there are other factors. This other indicator is more related to the effectiveness of the healthcare system. For example, preventable mortality. That are those deaths that can be avoidable if they are effective public health services. So in this case, we have here that the Netherlands shows a very good results and is among the countries with the lowest figures. And something similar happens with treatable mortality. That is that mortality or those deaths that can be avoided with effective treatments. So here again, Netherlands is among the countries with the best results. In the case of infant mortality, there has been a decrease in recent years, but the ratio in Netherlands, above the 3%, is slightly above the average of the country sample. Regarding population satisfaction, Netherlands also have very good numbers. So we have here that in 2022, around more than 80% of the Dutch population show satisfaction with the ability of the healthcare in the area where they live. So this is really a good number, although it has to be noted that there has been a decrease in recent years. So also it's important to analyze the health status and risk factors among the population. And in this case, we have found that obesity has increased in recent years from 13% of the population until 14% of the population. But despite this growing trend, Netherlands is also a country with very low ratio of obesity compared with their peers. So in terms of smoking, there has been a huge decrease in recent years from almost 21% to 12.7% in 2022. That number places Netherlands below the average, although smoking continues to be the high risk existing in the population. And in the case of heavy drinking, this is the numbers of Netherlands for people declaring heavy drinking every month or at least once a week. And in this case, these numbers are slightly above the average of other European countries. So here we have analyzed also if there are some inequalities in terms of results due to gender or due to socioeconomic studies. And we have found that life expectancy is is higher in women than in men, but when we see healthy life years, we see the opposite. That is, that men have more healthy life years than women. Here we have displayed the indicator healthy life years at 65 years old, and we can see that men have slightly more years than women. And this is a result that is opposite of the European average, where women usually have more healthy years than men. So we also found difference when we ask people for how they feel their own health. So we saw that there are more men that are declaring good or very good health in the Netherlands compared to women. And this difference is sustained over the years. And also is noticeable that the percentage of people declaring good and very good health declines, both in men and women over the years. There is also difference, for example, in the obesity rate. In this case, in Netherlands, women show a higher obesity rate than men. And this behavior is also the opposite in the European Union, where usually men have more obesity than women. So we also have detected some socioeconomic inequalities, for example, in the percentage of that population declaring good or very good health. Here we see that people with higher income declare more often to have good or very good health. So, and this is a very huge gap, about 30 percentage points, and is sustained over the time. So we also have detected some difference depending on the educational level of the population. For example, here we are presenting the percentage of daily smokers. So we can see that smoking is more habitual among the people with low education level, compared with, above all, with people with high education level. Okay, so finally, I will present a brief summary of the policy lessons that we can learn from the analysis. So we have seen that in Netherlands shows fairly a good performance in general. It has high expenditure in long-term care that is associated with low preventable and treatable mortality rates. There is higher density of nurses and slightly fewer physicians than average, but despite this high number of nurses, nursing staff at hospital is often overstretched. Child vaccination coverage is low, especially in the case of measles vaccination, and infant mortality rate is marginally above the sample average. There are consistent gender gaps in healthy life years at 65 and self-perception of good health favoring men. Obesity is higher in women, but daily smoking and heavy drinking is higher in men. There is also a consistent socioeconomic gap in healthy life years at 65, self-perception of good health, obesity, and daily smoking. In this case, favoring that groups of population having a high level income or high level of educational level. And finally, there are 2 points that may deserve special attention in the health system. One is high expenditure. So at least in the case of long-term care, this high expenditure at some extent may be due to some misalignment across the government, insurance, and municipalities that may translate into transferring complex patients out from municipalities to more expensive institutional resources. And also, it can be a potential risk selection, as insurers have little incentive to invest in improving care for the chronically ill due to insufficient compensation. And that could be all. Thank you very much for your attention.
Thank you very much, Esther, for this very interesting presentation. And I propose that we continue with the presentation of our interactive tool and our dashboard with you related to the health data. So the floor is yours.
Thank you. Perfect. So everyone should be able to see our screen. Actually, I'm going to start on APA's main website so that you can see. So Ivana mentioned to us earlier that you can find everything you need to know about this benchmarking study. On our main website, there's a tab at the top. And so I'm going to click on that. And we have our newly updated website, which is the landing page for this study. Here, you will be able to find all of the last sub-studies to download in full. We also have upcoming events, which I will show you also in a little bit. So here, we invite you to look into the different policy areas that are of interest to you, particularly the health one, which we are going to discuss today. Then we also have a brief description, all information that you heard earlier on, and our upcoming events are here. So it's useful to keep an eye out on this page because we will show our upcoming events relevant to this benchmarking project. Here we're talking, we're going to go into more detail about the health part, but I just show a little bit more. So we have also related news, which is updated regularly, and you can download each of the different chapters by going through these different links. Of course, we have the other information about the benchmarking study. So at the top of the screen, we have by chapter, all of the information on each of the dashboards and also our prior events. I'm just going to go quickly so that you can see what you will expect also when you look at the health chapter later on, but we have the recording of this session. So anything that, for example, Esther mentioned earlier that you want to catch up on, you'll be able to find on the recorded version of this session today. So now going to the health dashboard, I will hand over to Paulo. I'm sorry, I always give a little introduction to our page itself, so let me do that. So when we were developing these dashboards, we thought that it would be helpful to have two sort of journeys through the data. Mainly, you may have different interests in looking at the information, and also you may have, different interests. So for example, we have the sort of stylized version of the framework or model that Esther discussed in the beginning, and also Ivana. And so in this case, we're talking about the input, output, outcomes, but also we look at trust, which is one of the particular aspects of our benchmarking study. And then the health needs. So by clicking on each of these, you'll be able to get a journey that walks you through the chapter and the data that has been presented. And then also we have a more free form way of looking at all of the data, which Bjorn will present in a minute. And this is, you're much more able to make decisions about how you want to see the data, which countries you want to look at, etc. So we have these two journeys. So now I'll hand over to Paulo so that he will walk you through this more stylized step-by-step journey through the chapter.
Thank you very much. So we can start from clicking one of the buttons in this scheme, which depicts the conceptual framework on which the chapter, as all of the other chapters, are based. So we can go into the description page for input indicators, have a very brief definition of what is meant by input indicators. And then we have buttons containing different themes or groups of indicators that are presented in the chapter. So we can start perhaps with the first one, which has to do with expenditure in terms of health. As you can see here, we have displayed 3 indicators, one about health expenditure per capita, and in every case we have a definition of the indicators, one about health expenditure as a share of GDP, and finally one of the share of government or some compulsory or private funding of healthcare expenditure. An interesting feature here is that it's possible to look at different countries, but one at a time. So, for example, we can go into the Netherlands, which is quite prominent in this chapter. And we can see, as you can see, the data or the charts changed given our country selection, and as a result also the region, which is here in orange, also changed. And so we have, well, the first 2 line charts, we can see that the health expenditure per capita went up pretty much in the Netherlands for sure, but also in the region of Western Europe and in the sample of countries. Whereas if we look at health expenditure, well, here we see a slightly different picture, as whereas it, let's say, went up to a certain point in the Netherlands, then it went down and up again significantly, probably during the pandemic years, and then it went way down in 2023, which is or 22, depending on if we look at just the Netherlands or the other countries for which maybe there is more data, but yes, it went down significantly during the last years. And if we look at the share of expenditure, we can see that the compulsory schemes are, and here we look only at the Netherlands, are pretty much a very important proportion of expenditure, but we also have much smaller percentages for what concerns out-of-pocket expenses and even less voluntary schemes. With that, we can jump to a different section, the one on trust, or we can also call trust and satisfaction. And here we have 2 indicators displayed. Well, trust, let's say, is measured by the proxy of perceptions of corruption. And so, as you can see, once again, we can maybe focus on the Netherlands. And we can see here that the situation is relatively stable. Perhaps more if we look at the sample of countries, which is lower, let's say the region somewhere in between with a slightly decreasing trend. And the Netherlands, actually, it's interesting because it started from a very high level. And I should mention that here, perhaps a bit counterintuitively, a higher number actually means less perceptions of corruption. But this is how the index was constructed. And as you can see, the Netherlands started from a very high number, indicating very low perceptions of corruption, and it declined over time, but still remaining at a relatively high level, which is actually positive. Then the other indicator has to do more with satisfaction of citizens for what concerns the quality of healthcare where they live, which is a very important dimension to look at when trying to assess the performance of health or healthcare systems. And here we can see that, let's say that the levels are generally high, which is encouraging, which suggests generally, that people are in general, by and large, satisfied with the quality of healthcare where they live. if we look a bit at the situation in the different levels, you can see that, yeah, once again, in the Netherlands, this percentage is the highest, with a slight decline between 2012 and 2022. In the region of Western Europe, we see also a similar but very slight decline. And in the sample of countries where we are at slightly lower levels and with an even smaller decline, but nonetheless the picture is in general positive, it would appear from this indicator. With that, we can go back to the homepage. So giving you just a sample of the different pages that we have. And now Björn will guide us through the more, let's say, autonomous and independent way of looking at the indicators. So the floor is yours.
Yeah. Thank you, Paolo. Thank you, Paolo, for presenting. So in this model view, we followed really the approaches well taken in the chapter to show you the steps, the categories step by step. And we also created a page built on all the underlying data used in the sample for you to free roam a bit on within the data that was collected, with the idea to find like interesting answers. You read the news in your own research, you come across a policy that seems to be quite hyped in one country, then you maybe want to compare it with the time frame that the policy was implemented together with your own country. And we wanted to give you here as much as possible the freedom to set your own parameters. It is a bit of a dense site. That's the effect of like, that we wanted to give you the freedom. Most importantly, up here is the indicator that you would be interested in. Also, according to the framework, we put them in different categories according to the framework. And these all parameters on the page will react to what you put in. As you see here, there's a slightly denser degree of data available. That's why more countries popped up. You have here to the right as well the time frame that you can set for which data should be considered. And just for your orientation, we provided like 4 different ways of looking at them. The overview table is a standard tree map, but that gives you like an initial idea. The detailed value table as presented, yes, it's presenting the detailed values per year and per part that is selected. As you see, if you switch between indicators that are maybe a bit more information dense from the available data, it will automatically react. And this is now quite a dense picture because we couldn't include all of the countries. But if we would, for example, compare Western Europe with Northern European countries, it reacts automatically, and then it's already more visible. Most of the graphs, you can adjust them there. So just to look for what could be an indication for your further research, we wanted to give you a platform, a jumping off platform, to make it easier. And if you're more visually inclined, as many of us are, you can also then briefly jump through the indicators. For example, then on the geographical mapping, as Paolo mentioned, some indicators, just by the nature of it, the higher they are, that doesn't mean automatically the better they are. That's why it will always display some information about how is it indicator constructed, and you can also always hover across the information, so you get an idea on is like now the higher indicator, is that good or bad. So here in the framing, it just means the darker color just means more. And as you see, it will automatically adapt towards the sample that you selected. So if we, for example, okay, that's now thing, but I mean, interested in the older ones, you can always have like a backpedal option. If you're lost somewhere in your settings, you can always reset them there. And also the value indications will adapt to it, the whole page. And it's completely, so if you would switch between a category, you just need to select a new indicator and then it will reload immediately. And for example, if we would look at tobacco consumption and we're interested to just look into Western Europe, because there we had heard some interesting news stories. If I look at on the page on the timely dimension, most of the countries have that more expected downward sloping. But interesting to see is like, okay, something happened in Luxembourg between the years 2015 and 2020, and then it would be interesting to look at, okay, what actually happened there, if that would be like an exploration that you want to do. So you can play around and look at the data in actually the way you wanted this. One of the reasons why it's so dense, but we wanted to give you as much freedom as possible in the data. And briefly to mention, each of the indicators, they have a different sourcing. If you want them to download their own data packs, it will always display where is this data coming from. Okay, that was it from my side. So I'm briefly jumping back to the page and giving the floor back to Miranda.
Yes, so this is our dashboard, and we invite you to click on the link and get here. You also will be able to download this chapter on its own if you're most interested in that, and there's a button for that very easily found. And my last point that I want to make here is, okay, we have the authors, of course, those of us who worked on the dashboard, but any feedback or interesting questions you might have about the data and what you're finding, please feel free to submit them via the form, and we will get back to you in due course. So, Ivona, I'm passing the floor back to you.
Perfect. Thank you very much for a great job and a very nice presentation. And I just wanted to say that our dashboard related to the health data, it's already available on our website. So I would like to invite you there. But before we end our meeting today, I propose that I will go quickly to the last point and share the screen and present what actually is waiting for us in 2025 and 2026. So already mentioned what kind of sub-studies are available and what we are doing right now. So I already mentioned that right now, and we already started to work on the update of 2025, and which covers the update of all chapters of our benchmarking study, including, of course, health chapter, and separate culture and participation chapter. However, what I wanted to add as well is that chapters like health, making part of 2024 sub-studies, will contain mainly and will mainly focus on best practices, because actually the sub-study was published after our final conference in 2025, so the most recent data was presented there. This year we also prepared and already implemented 2 from 3 dissemination activities. The first one was related to climate change. Today we present study results from the health chapter, and in the September 23rd, what Miranda already mentioned, we will have the last dissemination activity related to the sport chapter. And we plan to have and present all chapters with culture during our final conference foreseen in 2026 in the beginning of February as usual. And we have still, what was already mentioned quite a few times, one upcoming dissemination activity and presentation of study results and dashboard for sport chapter, and it's foreseen on 23 of September. And registrations are already open, so I hope that you will join us there. So you already know this website where to find all information. So before I say goodbye to everybody, I wanted to thanks very much once again to Esther for a great presentation and be with us today, Frans van Dongen to be with us, also our benchmarking team, and to all of you to join us today during our meeting. So thank you very much. We are perfectly on time, and I wish you very nice afternoon and hope to see you in September.